This will be a short presentation to both Fast Care, fully assisting scanner technologies, as well as the enhanced Care or combined applications to reduce exposure features. Once the topogram has been acquired, the first thing you will notice is the beginning and ending imaging range has been appropriately placed and the field of view automatically adjusted. The body region assignment has been established and stored with the protocol on the Recon card. Switching to the body region to chest changes the imaging range including field of view, and again changing to lung encompasses just the lung and does not continue to the adrenals. With neuroimaging, the predetermined body region, if set to supraorbital meatal line, the imaging range will be set in addition to properly angling to the supraorbital meatal line. Should the patient not be isocenter, the system prompts the user to change the table height, ensuring optimal image quality. At any time, the user can manually adjust ranges and field of view. Previously, the user was tasked with deciding the field of view, where to begin and end the imaging ranges, often being very generous in establishing the ranges. Manually adjusting these parameters takes away from the time better spent on direct patient care. CareKV has been added to our dose reduction portfolio. Once the topogram has been acquired, CareKV will select the appropriate KV based on the topogram. The displayed quality reference mass and reference KV are the parameters in which the system uses as reference values, ensuring image quality and appropriate doses are maintained on all patients ranging from pediatrics to bariatrics. 70 kV has also been added to our existing kV selections of 80, 100, 120, and 140. 70 kV is a very valuable dose reduction tool, particularly in pediatric imaging. CareDose 4D's performance can be further optimized by organ characteristics in addition to specifying child, adult slim, and adult obese. As shown in the configuration, adult obese CareDose 4D performance has been modified to strong for both neck and shoulder, further improving image quality on these particularly large body regions. Many users have asked to see the dose reduction techniques implemented within their protocols. The Care dashboard is a visual representation of the dose reduction techniques within the protocol. Displayed in green are the dose reduction techniques implemented into this protocol. The adaptive dose shield, CareDose 4D, available since 1994, CareKV, dose notification. I will speak to dose notification in just a moment. Another new feature is Fast Adjust, which is seen in the bottom left-hand corner next to the load button. This is a single mouse click approach to resolving an imaging parameter conflict. It was often confusing for the technologist to decide what parameters should be modified within the previously used Scan Assistant to ensure optimal image quality, yet maintaining a reasonable acquisition time. A visual display of the current conflict is seen in yellow on the new dose profile displayed to the left of the topogram. You will see after clicking the Fast Adjust button the conflict has been resolved and imaging is possible. A dose notification is now displayed. Each protocol can have specific CTDI and DLP values assigned, alerting the technologist that they have exceeded the predetermined values. A diagnostic reason has to be documented prior to continuing. The acquisition has started. The first reconstruction job is a standard 3 mm axial slice. The second reconstruction job is a fast spine reconstruction. Auto detection of the individual disc spaces is done in both the sagittal and coronal planes, allowing for true axial images through the entire spine. Prior to fast spine, providing true axial images per disc was labor-intensive and fully dependent on the user's input. The users can modify the angles in all segments as seen here, first in the sagittal segment and then again in the coronal segment. Using the flexible option, you are ensured at least one slice is placed at the top, middle, bottom, and the center of each disc space. Relabeling of the vertebral bodies can be done by using the Apply Vertebra label icon. You can now choose which location of the spine you want to modify by simply clicking on the demographic. I will relabel L1 by clicking on L1 demographic and then clicking on the corresponding L1 in the sagittal segment. Note all disk bases have been relabeled to reflect the change. What was T12 is now L1. Within the reconstruction axis, there are multiple options available, including spine vertebra, which will encompass above and below the vertebral body of interest. One remaining feature to be highlighted is Dose Alert. Dose Alert is displayed only if the accumulated CTDI vol or the accumulated DLP plus the estimated values for the next confirmed scan range exceeds the corresponding alert value. It is a responsibility of the user to establish these guidelines. This concludes the brief introduction to both FastCare, fully assisting scanner technologies, as well as the enhanced care or combined applications to reduce exposure features. Thank you for your attention.